much for joining us today. We know that there's lots of things you could be doing today, so we really appreciate you joining us. The first thing we're going to do is we're going to start with a quick poll just to see kind of who's listening and what your experience is with lasers. And this will help us customize this to you. As everyone is answering that, my name is Jasmine Alderson. I'm the spa director here at LUX Medical Spa. You know, we're doing a presentation today on the Sciton Laser. So why Sciton? Because results matter. Of course, Susan and Maggie will talk to you more about what Sciton is. We'll advance to the next slide. Sorry, we're in separate rooms, so they have control of the screen while I'm talking. LUX Medical Spa, we have 2 locations, one in Bluffton and one in Hilton Head. Today's presentation will be by Susan Coker, PA, and Maggie Silver, our licensed esthetician. Both of these ladies were among the first providers at LUX Medical Spa. And they've been doing Sciton Laser under the supervision of our 2 co-owners, Frederick G. Winiger, our board-certified plastic surgeon, and Carmen A. Treywick, our board-certified dermatologist. We're proud to say that we are the only medical spa in the area that is co-owned by both a dermatologist and a plastic surgeon. Let's see here. So without holding it up anymore, I'm going to go ahead and end the polling. Let's just take a quick peek at, so we have about 58% have had lasers before. That's great. People are telling us what they've done, a lot of BBLs, a lot of laser hair removal. 42% has never had lasers before. And then people want to learn about brown spots. 42% want to learn about redness and sensitive skin. 50% want to learn about our laser hair removal treatments. And then 58%, wow, that's great, want to learn more about general anti-aging and maintenance. Great. Okay, cool. We will make sure that we gear the talk to you to answer those things. And of course, if you have any questions along the way, please message me privately, and I'll stop the girls and answer your questions. And again, this is Maggie Silver and Susan Coker. Take it away.
Hey everybody, this is Susan. So we have Sciton specifically at our office because we believe it's the Rolls Royce of laser. The science and engineering of Sciton deliver unsurpassed precision, particularly, which delivers safety and comfort and therefore the best results out there.
What is the Sciton laser and why we do use it at LUX? It's the best one out there, and we can treat a wide array of skin conditions, problems with it. We use it for Broadband light, which treats brown spots, redness, hair removal. We do treat it for Erbium laser resurfacing, light to deep, halo, which is a fractional laser, and then laser hair removal. So once again, we can reduce the signs of aging. It reduces a permanent hair reduction, sun damage, hyperpigmentation, freckles, rosacea, redness and flushing. It treats facial vessels, telangiectasias, fine lines and wrinkles, large pores, deeper wrinkles, and stimulates collagen and elastin.
We wanted to do a quick tour. We'll try this, and if the sound doesn't come through, let us know. I'll go ahead and start it.
It is not.
Oh, shoot. Well, anyways, this is our, we wanted you to see the actual machine. This is a Joule platform. On the right is the Broadband light part of it, and that is where you get the photofacial, and then also the for brown and for red spots. And then this part here is got the resurfacing arm. So you have the general laser. The energy comes through, amplifies through a medium. And the thing that is special about particularly Sciton is that it has the YAG erbium, which it specifically targets the blood vessels with the 1064, as well as the skin, and then you can also use it to spread the light out with the broadband light aspect of it, using different filters. And here's the different filters. So we have the arm, and then you can also put the halo here. So all in one. That wasn't as good as my other one, but let it go. Thank you. All righty.
So broadband light actually helps to repair DNA and it reverses cellular aging. So it reverses aging at a deeper genetic level. It targets brown and red, and it stimulates collagen. Okay, we're gonna try this one again just to see, but I'll kind of walk you through it if we can't. Jasmine, let us know if you can't hear it. Can you hear it, Jess?
I can't hear it, no.
Okay, so basically what this I'm just showing you is this is the broadband light module, and it treats all skin conditions. It uses a sapphire plate, which treats a larger area, and it makes it a more comfortable treatment. So safety and comfort. We can treat all areas of the face and body as single targets, body vascular rosacea, facial bruises after injections. So this is a patient. I treated her for laser hair removal with the broadband light, and this is her right before her first treatment. She came in about 8 times, and this is right after her 8th treatment. I would say over about 1.5 years. And this patient, it was life-altering for her. And she actually moved away, and I gave her the name of an office in Arizona that she's been kind of doing her maintenance treatments. But just, she was shaving like 3 times a day. But you can just see how clear her skin is and just how smoother it is. And of course, she, a couple treatments after doing her chin, she wanted to do her underarms. And this was right before she had moved away, and just not shaving, and it just makes the skin smoother. And as you can see, she still has a little bit of hair there. And that's why we call it permanent hair reduction. And you should get about 80 to 90% of hair reduction. So this is the broadband light for pigmentation and redness. In this here. This is a rosacea treatment that Rebecca did on this patient. I think she had 2 treatments.
I think that's just after 1, though, if I remember correctly. No, I wish you could make it. All righty.
So this is a video I was trying to show of the photofacial, which helps to remove damage in the skin. So whether it be redness, brown spots, and we recommend doing a series of these. Once you get to your desired result, then you come in for what we call as a forever young maintenance treatment. And doing those a couple times a year actually helps to repair the skin. And long term, it really helps for anti-aging.
This next one I just love. This one you can find on YouTube, but it goes into the background of the actual science that the study that Dr. Bitter and Dr. Yang from Stanford University had done. So hopefully this will sound a little better. And I'll put this one on. That's showing the actual changes. This part is she's talking about they found the fountain of youth. Can you hear it? Can you hear it?
No, I cannot hear it.
Oh, shoot. So they're talking about turning about the aging and the hands of aging. And then this is talking about one particular office in California that has started doing it. And this is the actual skin tight, which gives you the tightening. And we do wear glasses that protect our eyes from the light. And then this is for the red and the brown, the last one that she did. It's a little bit slower. And this is talking about how it actually changes the RNA, DNA of the skin to reverse the aging process. And this is a study done using, I can't hear that part, but anyways, it actually reverses in the skin itself, the aging. And that's over a series of time. The study was done over the average of 8 years, two broadband light or photofacials per year.
We have a question.
And then these are some ladies that have actually done it.
What's the question, Jazz?
Someone would like to know, what does the treatment feel like?
So it kind of feels like a hot rubber band snap. So it's not like excruciating, but it's not a facial. So there's definitely mild discomfort. And it just is, it's heat. So it kind of feels like a mild sunburn after, but it's not excruciating. I've never had somebody stop me and say, I cannot do this. But it's not made to be a really aggressive treatment.
All right. Thanks for going through that with us. So this is actually Dr.
One other
Moore.
question.
Okay.
Sorry. Does all laser hair removal treatments take 8 treatments?
So everybody's different. So depending on the area of the body, whether it be face, lower, down, lower, typically it's about, I would say 8 to 12 treatments, and that's over a period of a couple of years. So once you get your initial, I would say 4 to 6 treatments out of the way, then you kind of go about 3 to 4 months, come in, treat the area, and you'll just go longer and longer in between treatments. But over a course of, I would say about 2 to 3 years, after that, then you can kind of, it should be, what you see is what you get. But as with anything, you want to maintain it. So once you get the hair to where it's not coming back, come in once a year, treat the area, and it just makes it a bit better to maintain.
Another question, if you're up for it. What is the typical healing after BBL, and then downtime for laser hair removal as well?
So downtime, really no downtime for laser hair removal. You can have a little redness. Bikini area, definitely a little possible redness, a little discomfort. So you'd want to avoid like working out, wearing anything tight, very tight fitting, swimming, anything like that for about 48 hours. But laser hair removal is pretty easy. Downtime with BBL, I would say for the face, it's about 4 to 5 days of where you'll notice some like little brown spots, kind of like black pepper in the skin. And that can take about, I would say 5 to 7 days to fully.
On the face, yeah.
On the body,
longer.
it can take about two weeks for everything to fully exfoliate off. You definitely want to avoid, hot saunas, yoga, working out, anything outside, swimming, beach for about, I would say about a week or 2.
The other thing that I think it's important that maybe we should point out now, with all of the broadband light, you want to stay out of the sun. If you've got a suntan, or even if you've got self-tan, or part of how the process works is it targets that pigmentation or that brown that it sees, or in the case of hair removal, it's targeting the black, but it will also pick up on pigmentation. So it's really important that you don't come in with a tan or with having had a spray tan even.
Can you shave or tweeze between laser hair removal treatment?
Shaving only. Tweezing, hair removal creams, waxing is, you should totally avoid that while you're doing laser hair removal and after doing your laser hair removal treatments.
Questions are just rolling in like crazy, which is great. I love this. It makes it more catered to you guys. If I self-tan at home, how long should I wait before and after treatment to treat again?
So it depends on the self tanner that you're using, this, and your skin type. Typically, I have people that will not spray tan for about 2 to 3 weeks before their laser hair removal. And then like 2 days after treating, they'll go get a spray tan. But I tell patients if you're gonna spray tan, especially on the body, in between, use a body scrub or some kind of exfoliant about 7 days before, just to get all that residual tan off, just so that you don't show up for your appointment and can't get treated.
Thank you.
And one other thing, the laser hair removal targets dark hair. So if you have gray, blonde, or even like a really, really light brown, unfortunately, the laser won't treat that.
Any other questions?
That's all that has come through right now. I'll stop you if more start coming.
Okay, great. All right, next we wanted to introduce Halo. That is the newest in the lineup of on the Sciton platform. Kieran and I have been doing the Halo, I guess, for about 3 years now. And at first I was kind of like a little skeptical because I really like resurfacing, and that's my background. And then we got the Halo, and when I started seeing the results in the Downtime, I was floored. So I've been really, really excited about that. And maybe Kieran can comment later too. It's been a really fun treatment. So wanted to kind of introduce that. I think I say get your glow with Halo, because it does that. There's something about just about 3 weeks after that you do, your skin really glows. And it feels good. It looks different, and then it continues to look different over the next really 6 months. It's long lasting. The beautiful thing about Halo versus other types of lasers is it's the only hybrid laser. So you get a deeper, the 1470, a deeper treatment that stimulates the collagen, and then on the surface, you get the resurfacing, or taking off that very top level, and you can actually customize to the patient how much downtime they want, what results they want, what kind of skin they want with the machine. So it's a dual action, and the two together actually work better. They're synergistic and just get amazing results. So it does treat discoloration, sun damage, visible signs of aging, i.e. wrinkles, uneven skin tone, pores, and then also scars like acne scarring. And I think part of that glow is that combined, the deeper and then the more superficial. This explains a little bit more. So you have what I was talking about before. You have the superficial on the surface here, and then the deeper non-ablative that gives you the tightening and also the texture change, and also improvement in the pores. And this was going to be our tour. I'll put it on just so it'll prompt me. So you can treat different parts of your body, hands, chest, perioral. We can do a secondary treatment. And again, to be able to customize. This is the Halo arm here. It's got the vacuum. And then also on the other side, it's got a coolant. So it's, I don't know if they can hear it all, but anyways, that allows us to cool the skin at the same time. We do use topical numbing as well. And this shows you a little bit more about like the body.
The questions are rolling in. Do you want me to wait until your video finishes or ask them as the video is going?
I guess ask them as the video is going.
Okay. We have one question. How many sessions for fine lines and sagging around the mouth?
Part of it depends on how much time you can give us. If you have like 5 to 7 days, then we can use the deeper settings. And again, that's on the right where you change it out. And then if you don't have that much time, if you want more like a weekend peel, I'd say do them 4 to 6 weeks apart, and start with 2, then wait 6 months, and then possibly do a third one. But generally 2, and you're really good, even with minimal downtime. This part here shows where you can customize it. So if you're particularly concerned about like the upper lip and perioral area, downturned corners, you can actually do a second pass or even deeper settings on that thicker skin on the upper lip and around the mouth. Because remember, that's your thicker skin. Around your eyes is the thinner skin, so you don't want to go as deep there. And the beautiful thing about Halo is you can customize it and go deeper in certain areas, not as deep in other areas. Most common definitely is going to be around the mouth. We frequently do a second pass or deeper settings with that area. Anything else?
Yes, they want to know, why do you need a cooling device?
The cooling device makes it more comfortable. Having the Zimmer was the name of it, delivering air right on your skin that's freezing cold, just makes it so much more comfortable.
Are yearly treatments recommended?
Absolutely. We'll get to that a little bit more at the end, how first you're going to get your face in shape, and then to maintain it with the yearly. Most people just recommend yearly once you get it in shape.
And good skincare in between.
Yeah, of course, the medical skincare.
Is it safe for all skin types?
Yes. That's a great question.
That's a good question. I have a lot of people questioning what the cost is, and that's really hard for the ladies to answer without doing, we wish we were open to. Somebody just said, wish you guys were open. We wish the same. We'll get there. We're working on it. We just got to do it the right way and make sure we can practice safely to protect our staff and our patients. Okay, so back to the question of everybody wants to know how much it costs. It's really hard for the ladies to give a cost without a consultation because of everything Susan said and the areas treated and all of that. So we would certainly, if we did a virtual consult, which is what we're doing now with you, then the virtual consult would consist of giving you a quote and diving deeper into the cost of the treatment as well. It's hard to lay that out without knowing exactly how they're going to treat you.
Part of it is we want to find out what the results that you want to achieve, and the number of treatments would affect the cost. So going with the cost, it's like everybody's different. If you have a lot of really deep wrinkles, we're going to recommend at least 2, and maybe even resurfacing, depending on how long you want to take, how much downtime you're willing to give us. So it is really very individual. Anything else?
That looks like there were other questions, but you basically answered, like, how often can you have? Do you recommend multiple treatments? We answered that. How long do you wait in between? I think you answered that.
4 to 6 weeks.
Yeah.
And it's good just to come in for a consult anyways, just to see if this is what you actually need. Some people may need something deeper, or so it's important to do that.
Is Halo good for skin over age 65?
Absolutely. that was one thing. I mean, it was such a game changer, and then so much less downtime than with the resurfacing.
Great. I'll stop you if we get any more.
Okay. All righty. Thanks for the virtual tour, patients. And this is just pointing out that you can treat a specific area, measure that area out. You can treat the neck, you can treat the chest, you can treat the perioral, even do it twice if you want, and then also the hands.
Question, do you have to wear Aquaphor with Halo?
Absolutely not. That's
Not.
an added little bonus.
It's definitely not as messy, that's for sure. Oh my goodness. So we'll try this again. If not, let us know. This is an actual demo of the Sciton Halo. Someone getting it done. Are you grooving? Can you hear it?
You can kind of hear it, but it's
Not
like in
super
the background. Yeah.
Okay. So it's obviously doing the forehead, and you're going back and forth, just kind of a smooth motion. And that's the, shows the hybrid, the pixelated kind of pattern with it. I think the non-ablative depth, if I remember at the beginning, they set it at 400. So you can see it's pretty simple. She's even smiling. It tickles a little bit, honestly. It makes you kind of want to sneeze. And probably the upper lip is one of the more uncomfortable ones, so try to get that out of the way at first. And that's the Zimmer. So that's so cool, and she's like all blissed out. She's reaching nirvana now. Oh.
Okay, we have some questions. As soon as it stops, we'll.
All righty.
Well, one person did comment, why are those ladies not wearing gloves? We do wear gloves at Lux. This is not one of our videos. We do wear gloves. Her nails are pretty, though.
They're very good.
Somebody wants to ask, how does this treatment, Halo, compare to Fraxel?
Well, that's a great question. I was trying to get to that with some of the, probably did a better job on the videos, but what sets Sciton apart from the other CO2 lasers is that YAG erbium. So the CO2 is the medium that the photons go through, and that determines the type of light, the width of light. This is probably too complicated, but anyways, that's going to give you the difference between the YAG and the CO2 is that the CO2 heats the skin up, so you tend to get more burn. With the Fraxel, you're not getting any of the ablative aspect that you get with the Halo, which gives you a lot of the smoothing. You're only getting the pixelated ablation without getting some of the tightening. So it's more painful, definitely, than the Halo is, the Fraxel is. And you get better results. Like I said at the beginning, that they work synergistically. The ablative and the non-ablative work together, so you get much better results with fewer treatments. This happens to be one treatment, the one that I've got up on your screen now. She had, I think she was around 60, in her early 60s, and obviously had a lot of sun damage. So she came in for possible resurfacing, but didn't really have the downtime. So we went ahead and did this is just a Halo, no broadband light. And you can see this is that glow that I was talking about here. Just, yeah, the lines are gone, but her skin just glows more. And that's not something you can get with Fraxel, and especially with just one treatment.
And I will say that 95% of the photos on this slide are specific to Lux. So this is what we, here have treated, and some of the results that we have gotten. So just wanted to share that.
And as far as downtime, go ahead.
Oh, sorry. Everybody's saying beautiful results. These results are amazing. Someone said this is my favorite before and after. But then one person does ask, how is the pain with this treatment, and how long does the treatment take?
The pain is fine. Some of it, when you're going deeper, it's a little uncomfortable. But on this lady, I think I did 450 non-ablative, which is a deeper, but not as deep as you can go. Like for acne scarring, you'll go deeper than that. And the the bigger downtime is not pain. It feels hot at first, but then that goes away usually within 30 minutes. I think when I had it done, I did take some ibuprofen when I had the deeper one done the next morning, just because it felt hot, but not painful, just, like more like a sunburn. And then the big thing when you're going deeper and you're putting a lot of energy into the skin to get this tightening that you can see here, you have to put a lot of energy into the skin. So that causes swelling. And her bigger downtime was the swelling. After 3 days, the swelling just kind of magically goes away. If you can sleep sitting up, that helps quite a bit. The Benadryl at bedtime also helps. And then by day 3, she just had the mins, which is, it looks kind of like very fine sandpaper. Yeah, it feels that way too. You can actually cover it really well with makeup that just doesn't look quite as smooth. And then starting about day 4, that sandpapery mins comes off, and generally everybody, even the deeper ones, between day 5 to 7 are good to go. She went back to work. I mean, she could work and everything because she had her own office. She could work in the back office, but I think mostly out of boredom. She wanted to go back in, and but she wouldn't want to go to a party really probably for about 7 to 10 days with the deeper ones. With the lighter ones, you can, with the very lightest, you can go back the next day. You don't have so much swelling, but again, you're trading results off. So we wanted to go for the gusto and get the best results possible, and she was willing to kind of put her life on hold for about 3 days. Like I describe it as when you can go to the grocery store without people looking. At 3 days, when you do the deeper one, people are going to look at you when you go to the grocery store. But by day 4, you can go, especially with a COVID mask, right? But so anyways, I hope that answers the question. If not, I'm happy to go over it some more. Anything else?
That is all that's come through right now. We love these questions, though. Keep sending them.
So this is a lighter halo. You can see she got some good results here and here on the brown. I think she did have BBL at the same time, which is a beautiful thing about the Sciton platform, is you can combine these treatments to have the same amount of downtime with just incredible results. And again, on this lady, you can see that halo glow. She looks smoother. Her skin just looks healthier.
Smoother, brighter.
Yeah, brighter.
Tighter.
A question that relates to that came through. How does this recovery compare to other deeper lasers?
It's night and day difference. Yeah, 3 days versus 3 weeks.
And no aquaphor.
And no aquaphor, yeah. And even the deeper, when you're going with the Fraxel, the deeper Fraxel, you're going to have more downtime and even more swelling.
Does this help with large pores?
Absolutely. And this is another lady.
That's amazing.
And this one, I think, yeah, you can see the upper lip here. This, if I had done resurfacing, I would still be a little disappointed with this upper lip, but not with the halo. You get nice results with very minimal downtime there. And then this lady's melasma. Melasma is hard to treat. Maggie can talk a lot about that. She could probably do a whole presentation on melasma, but it's you can't use the BBL so much with the melasma. It's a little trickier and tends to be more hormonal. A lot of people get it when they're pregnant, and then it's hard to control, and generally it's a kind of a chronic skin condition. But this is with just one halo there. I've got to reverse. I just noticed that. This is her before and this is her after. Sorry about that. I'm glad I caught that. Unfortunately, not until now. So now we're getting into the deeper ones that have more downtime. I didn't want to show you the downtime on the perfractional because it really looks, the deering, it looks bloody. You're going deeper. You're getting a lot more ablation. You're still using a pixelated type of treatment, so it does heal much faster than the resurfacing. Generally, when you're doing perfractional, you're thinking of doing at least two, depending on what kind of scars you're going after. But generally, you're doing at least two treatments. Frequently, with deep acne, we're doing like 3 and combining that with the resurfacing even. So it still has less downtime because it's pixelated. It treats not all the way across the board, but making the channels into the tissue. And this is just with one treatment. This gentleman was kind enough to let us show his pictures. We've got others, but we don't have their permission. So I just wanted to show this one. This is a gentleman in his 70s that had always had acne, and he just wanted to try it. His wife had actually done a resurfacing, and he decided to wanted to do something for his acne with less downtime than his wife, because he did nurse his wife through it. And so this is about 4 to 5 days downtime, but it looks worse, and you do have to use Aquaphor because it's more ablative than the halo, and doesn't use the synergistic. He could have done a halo. Might have needed like 2 halo treatments for the same results.
Question.
Mm-hmm.
So I'm in my 40s, and I don't have any major skin problems, but I do have a little sagging, fine lines. Could this help me? That's for the halo.
Yeah, I think definitely so. It's more of a maintenance type of treatment. You can do, depending on, you have to, again, look individually, but depending on how much fine lines, how much sagging, consider doing 2. You may want to, because you can see a difference pretty much immediately, but you see full effect, I would say, out to 6 months. With someone that has that wants to improve on their skin, isn't totally happy with it, but it's not as corrective. I would space them 6 months apart, and then perhaps like just maintenance would be like once a year. We also have Skin Tite, which is a Broadband light that for people in their 40s, it's a good maintenance treatment. I don't think it's as good as halo for some of the tightening if you have someone that has a lot of sagging. But it's good, more of a maintenance preventative, the Skin Tite. What do you think, Maggie?
I do. I think the Skin Tite definitely helps to maintain after really anything, especially after facial surgery, facelifts, things like that.
But again,
sorry, go ahead.
No, I was going to say, I think it's more of a maintenance, the Skin Tite. Go ahead.
I'm not sure if this is for perfractional or if this is for halo, but they want to know if you can compare it to microneedling.
Totally. It's halo is like microneedling on steroids.
I would say like 6 microneedling sessions, you can get one halo with.
The microneedling won't give you the smoothness though.
Yeah.
That'll help definitely with the texture. But I would say, depending on the skin, start with a halo and then kind of maintain with your microneedling.
That would be one way, yeah.
Very good. Yeah, she said she clarified halo, so perfect, you answered that.
And this is just another perfractional for acne. This one is, I think, 3 treatments. Spaced 4 to 6 weeks apart. He could use some Botox too. All right, and this is the one that I fell in love with, Sciton, because of the results working with Dr. Winiger of the laser resurfacing. And that made me think, well, I don't know about this halo because I'm just not getting the results. But then when I started getting really good results, going deeper, and with the downtime and just how happy the patients were, I've done a lot less resurfacing ever since then. So it's someone that has really deep lines around the mouth. The resurfacing is the better way to go. If you can give us about 2 to 3 weeks downtime, so you can see here versus here.
And don't let the photos scare you.
Yeah,
We have some
we'll show you the downtime. So this one, you can see it's just dramatic results. That would probably take at least 2 halos, at least. And then here is a before, here's the after. And this one is just showing you the Aquaphor. That's all it is, Vaseline basically. But you see how red her face is. This is, I believe, day 2. And you still, her face is red on out today to week 3, I believe. And you can see here, this is a coag, the one that heats up the tissue. And that gave her this really nice smoothing and tightening in through here. So this is, at this point, I think I may be able to get close to these results with 2 deep halo.
And I see her from time to time, and her skin looks better now than at this 4th picture. So it gets better over time.
And then this next lady is deep resurfacing. And this is the result that you can expect with resurfacing. So you see that's just night and day difference.
And we did a laser peel, like a lighter laser peel on the majority of her face. And then Susan did the deeper, kind of, around her mouth.
And so you can see here is definitely, this is deep. She's got a little bit of bleeding. This is 3 days after. This is a month after. She's still red. Now, she could put makeup on at this point. The one before actually went on a cruise at week 3. But you can, you still got that downtime. So that's 3 weeks after. And with halo, you're not going to see this 3 weeks after. But you're
really
not going to get these incredible results.
A painful thing here. It just looks a hot mess, but it's not like she's in excruciating pain. But just FYI.
Yeah.
People are really impressed with these results from your first to your 6 weeks after. And they want to know, did she have filler in her cheeks?
Never. Nope. She's never had anything. And basically we had to talk her in because we told her surgery first, and she didn't want that. So we had to talk her into doing this. And I see her as well. She uses her Retin-A every single night, and her skin looks, I think we did this 3 years ago. And her skin looks exactly, if not better than this. But yeah, she's never had Botox, filler, surgery, anything like that.
And if she wanted, she could do maintenance. If she had brown spots, she could do BBL like twice a year for the Forever Young, or just to keep her skin from aging. And then she could do like halo once a year. To me, she's never going to have to do a resurfacing ever again. She's at a good point. If she maintains it, she's going to be great. Sunscreen.
So the results from resurfacing are permanent?
As long as you wear your sunscreen, use your medical skincare, maintain your results, because if you go back out in the sun, your skin's going to damage. So you definitely want to make the commitment to keep your skin the way it is.
Great.
Yeah, I think also, it's not going to stop you from aging, and that's where that Forever Young comes in. And we'll try that video again, just because I think we might have gotten one of the kinks out a little bit better. We'll try this again, and if not, Maggie's going to walk you through different modalities. But this shows you, this one's particularly the BBL on the platform. The skin tight was the other one we talked about.
And
these are the different things you can treat.
And you can, what is also good about the Sciton is that you can combine so many treatments. So you can do your halo with your BBL. You can use your broadband light with the laser peel. So there's, you can combine treatments for a better result. And that's what makes the broadband, like the Sciton laser and the broadband light, just so amazing.
I will try it.
They want to know when you should start your skincare.
Oh, okay. Yeah, that varies on the treatment. Is that coming through?
No, not really.
Okay.
Darn it.
So this is just showing that we can combine treatments. One of my favorite treatments to do with about 5 days downtime is a palmetto peel, and that combines broadband light and an erbium laser resurfacing. You do have to wear Aquaphor for about 3 to 5 days, depending on depth. But it's a good way of combining really deeper, bringing up some pigmentation, and then, getting rid of the surface, so kind of polishing the skin. You can combine the broadband light with the halo. So the broadband light kind of, really targets deeper, but doesn't, remove any skin. So it really helps to pull up deeper kind of pigmentation and damage. And then you can kind of polish the surface off with, your halo and peels.
All right. So this is.
Oh, yeah. I was just reminded. Our marketing coordinator, Libby, is on, and she just messaged me. These videos that you can't hear are on our YouTube channel. So you can go to our YouTube channel to watch these videos after this presentation. Duh, I forgot all about that.
Thank you. We worked so hard on them.
Yes, the girls did work really hard, so they want you to watch them.
Okay, so like putting it all together, this is a lot of what we talked about, is basically you can reverse aging with Sciton, and that's the really exciting thing that one video explained in 2 minutes beautifully. But anyways, so once you get your face in shape with the BBL, with to get the brown and the red, and sometimes on your face hair removal as well. And then either if you've got acne scarring, do the perfractional, a couple of those at least, depending on how deep the scarring is. You can do a halo.
You can combine the perfractional with the halo. You can combine
the resurfacing even with the BBL, or you can, like we did on that last patient, we did the resurfacing around the mouth, and we did a lighter peel. Maggie did on the rest of her face. So once you get your face in shape, then just doing the maintenance to keep it that way, twice a year at least, or even quarterly, Forever Young BBL, and then the halo annually. So once you get your face in shape, you don't have to do tons and tons of treatments to keep it there, and you can have the skin that you want.
And what the Forever Young is basically, it's a maintenance treatment, and there's clinical studies that has shown that if you do them a couple of times a year, it actually helps to slow the aging process. It repairs damaged DNA, but it just keeps the damage away.
We do have a question. Are these deeper treatments good for younger patients who want to prevent signs of aging?
I would say no, you don't need the deeper treatments. I would do the halo. If you want to prevent signs of aging, do the halo, the Forever Young.
Forever Young, Retin-A, sunscreen.
Ounce of prevention's worth a pound of cure. So yeah.
Perfect. Well, we'll stay on a few more minutes, take more questions. The next steps. So we have several next steps. You can, of course, do nothing after this, but we also are offering virtual consultations. And I just sent a link out. You can use that link. It was also on that slide as well, that last slide, to schedule your virtual consultation. Those are $49 right now, but then we give you a credit to shop in our online store, which our online store is there as well. And if you, obviously you can't click on these links on their screen, but you can just go straight to our website to get those links. And we are giving you a coupon since you joined today, it's a thank you 10, and that will give you 10% off your purchase from our online store. We do also have some specials going on this month. My favorite one is our Mother's Day gift card special, so you can go on and buy gift cards. Of course, you can use them for yourself if you or purchase them for others. One thing the girls didn't talk about, but I'm going to talk about to brag on them a little bit, is they have done a ton of these treatments, and they are continuously educating themselves by going to, right now, virtual trainings, but also they've gone to our user summit, which is the Sciton User Summit. They go to Dr. Bitter's office. Yes,
Dr.
yeah, tell them, you guys.
Dr. Posner, who's like the pioneer on the resurfacing aspect, that was amazing. I did one, Dr. Larry Helwig, Clear Skin Institute, that was years ago on BBL. But we're always educating ourselves so that we can, get really good results and safe, good results.
Yep, and this is our passion. We're always trying to achieve better and better results with less downtime because that's what you guys like. Asking for the link to our YouTube videos. Bear with me just a second if you don't mind, and I will find the link to our page. Let's see. And post it back in the comments for everyone. Yep, and we definitely encourage you to subscribe to our YouTube channel. That way you'll get the most up-to-date YouTubes that we publish, and also subscribe to the Sciton YouTube channel because they offer really good videos to see all of this stuff. I'm going to launch one more poll here real fast.
Jasmine, we're going to play this and see if they can hear it again.
Okay. No, not really.
Okay.
So bright, normally you can't wear dark goggles. It's the blinding light that's not only making skin look younger, but is actually causing the skin cells to become younger.
We took the old skin and reversed the gene expression to a large degree to that of youthful skin.
That's right. It's actually changing the DNA of skin. A new Stanford clinical study shows that rather than just a cosmetic mimic of young skin, what's going on here is altering human genes associated with the aging process. And plastic surgeons like Dr. Elizabeth Lee of Berkeley and Lafayette are impressed.
It's kind of as close to the fountain of youth as we actually have.
The laser is called Sciton Broadband Light.
People started asking me what I was doing with them, what I was using on my skin.
Michelle is receiving the Broadband Light treatment here at Spa Radiance Medical in San Francisco to try and improve her skin.
Well, definitely. I mean, all the skin on my body has changed as I've gotten older.
And after 4 sessions, you might be surprised to know Michelle's real age.
I'm 43, almost 44.
People in their 40s and 50s are still producing a lot of collagen. They're going to get a better result, say, than someone who's 70.
Your cell goes back to how it was 10, 15 years before. So literally the cell becomes younger.
This is science. This is science.
I think we found the fountain of youth.
In San Francisco, Vicki Liviakis, Cron 4 News.
Well, the broadband light therapy is currently being used by a number of dermatologists and plastic surgeons in the Bay Area, mostly to treat skin damage from too much sun. But now that the Stanford study is out and showing that there are other anti-aging properties, you can imagine that therapy will likely be in high demand.
So I did want to point out again, this is age 44.
And this is Dr. Bitter.
And this is age 55.
Who created the photofacial. And he does them on himself, and he look at his
does
skin at
quarterly.
44 and then at 55. So it really just makes the skin look healthy, gets rid of all the damage, and by doing so, it makes it brighter, just more youthful looking.
Healthier. All right, that was it. Thank you.
Are we done? You there?
Oops, sorry. My mute was on, but I was talking to everybody. I'm so sorry. Everyone, thank you so much for coming. We did get a couple people that said they'd like to be contacted for virtual consultations, so we will contact you to set that up. If you weren't able to answer a poll but would like to have that, then just go to our website and sign up yourself, or send me a direct message and I'll help you out with that. Again, thank you guys so much for coming, and if nobody has any other questions, then I will end today's meeting.